Good afternoon. I hope you're having a great Saturday. And today I want to talk to you about a condition known as extreme chronic illness. You may have heard of chronic illness, but many of you may not have heard of the phrase called extreme chronic illness. It's a phrase that I recently coined, and it deals with patients who are so ill that they're in a trap between their baseline chronic illness and the medical interventions that are used to treat those chronic illnesses. These chronic illnesses and the medical interventions have a unique interplay into these individuals' lives that result into a progressive, more accelerated chronic illness that's very difficult to treat. So I'm going to share with you the concepts of extreme chronic illnesses and how you can avoid it. So stay tuned. Okay, so again, welcome back. And let's get right into it. This whole concept of extreme chronic illness is a concept that I thought of, actually have been thinking of over the last several months. And it involves a number of patients that I've been asked to help manage. And I'm going to share a situation with a patient that we recently treated with extreme chronic illness. And I'm going to share with you how we dealt with that patient's condition of extreme chronic illness. So let's get into it. Um, Extreme chronic illness, how bad is it, and how can you avoid it? So let's start off with a basic definition, because I think if we understand what something is, we can understand how to avoid it. And better yet, if we're trapped in this condition, we can understand what it is and we can understand how to get out of it. So what starts off with chronic illness? And I like to start off in stages. So the early stage of chronic illness starts off with things that we're very familiar with. It starts off with poor lifestyle, poor nutrition and hydration, no exercise, poor sleep, emotional stress. Now, many of us may be living in this phase zone. You may not have a diagnosis of diabetes or high blood pressure. You may not be taking any prescription medication. You may be going through life thinking that you're healthy. I'm going through life, I'm thinking I'm healthy, I've got a new job, but I'm working long hours, I'm not sleeping well, I'm exercising less, I'm getting to a point where I'm not exercising, I've got stress on this new job, I'm eating poor food. So this is the early stage of chronic illness, because chronic illness starts before your medical diagnosis is provided. Chronic illness starts when you start to live a poor lifestyle. So things are building up inside your body that are leading to biochemical imbalances and physiological imbalances that are forming the foundation of your chronic illness. So chronic illness in the early stage starts with poor lifestyle habits. The next thing that comes about is when you have symptoms or some problem, or you're getting a routine evaluation by your doctor, and then you're given the old famous diagnosis. Oh, your blood pressure is elevated, or oh, your blood sugar is elevated. You have diabetes, you have high blood pressure. Or you have abnormality on your EKG, you have heart disease, etc. And this is a condition, is the next phase, and this is when you have a diagnosed chronic illness. Now, oftentimes individuals in this phase may be in a situation where they may not be prescribed the medication right away. Perhaps they have prediabetes. The doctor may say, well, change your lifestyle or whatever the case is, and you may go back to the early phase and start to clean things up. However, what frequently happens is once you're given a diagnosis, then you prescribe the medication, because the standard medical treatment approach is to put patients or place individuals on indicated medication for your diagnostic label. So this is the next step of the early stage of chronic illness. So once you're on medications, many people may stay in this phase for a long period of time. Maybe your medication controlling your diabetes, maybe it's controlling your blood pressure. Maybe you start to exercise more, eat better. So you probably stay in this early phase for a long period of time, maybe indefinitely. And some people can exist here for a period of time. But some individuals start to advance to advanced stages of chronic illness. So the advanced stage of chronic illness is when you get more aggressive standard medical intervention. So you're getting prescription drugs, you're getting multiple prescription drugs, you're getting multiple medical procedures. Some are diagnostic procedures, some are therapeutic procedures. Some of you getting surgeries. Sometimes it may be obesity surgery. It may be a surgery for your low back pain, a surgery on your back for arthritis on the spine. You may be hospitalized frequent times, maybe have heart failure on heart failure medications. So this is a more advanced form where you're definitely on medications. Medications are needed to help control your chronic illness. Now, the diagnosed chronic illness, some people may be on medications, but medications in that situation are a little bit optional. In this situation, medications are needed. They're needed to keep your blood pressure down. You may be on 4 or 5 blood pressure medications alone. So this is a situation that you can, this is what I call the slippery slope, because here's a situation where you're likely getting medication side effects and you're likely having medications cause other illnesses. So if someone has systemic inflammation, they may be on steroids that may be causing diabetes or worsening the existing diabetes they have. They may be on a statin drug causing muscle pain or arthritic pain, or again, worsening their diabetes. So then you slip into the next phase, which is the phase I call extreme chronic illness. This is the phase where the trap episodes begin. So you start off with worsening lifestyle. Why is this lifestyle worsening? Well, you're in the hospital so much, you're not able to exercise, or your arthritic pain is so bad, or the medication side effects are so bad, you're not able to exercise, or the medication are keeping you from sleeping. So this is where the medical treatment and chronic illness is working together, if you will, to make you sicker, because now you're not able to sleep very well. You're not getting fresh air and sunshine. You're in the hospital eating poor hospital food. You have a continued progression of the disease, so the treatment's not stopping the disease, and the medical treatment side effects are worse than the actual original disease itself. And then you have a chronic illness medical treatment trap. That's when the medical treatment and the chronic illness are working together. They're making you sicker, but it's hard to pull the medical treatment away because you have a dependence on them to a certain extent. And it's hard to reverse these diseases because they're keeping you in the hospital, and it's not allowing you to get to the crux of the matter, which is to change your lifestyle. So these are the stages of chronic illness, and this is what I call extreme chronic illness, and this is what you're dealing with. So let's talk about the patient that we dealt with. This gentleman came in with advanced heart failure, and he flew into our center. We're in Houston. He flew in from the West Coast, and he was diagnosed with advanced heart failure with stage 3 kidney disease. He had liver cirrhosis, secondary to heart failure. When the heart begins to fail, when it's an advanced failure, other organs start to fail because they're not getting perfused, they're not getting oxygenation. So like the liver and the kidneys start to fail. He also had type 2 diabetes, he had hypertension, he had atrial fibrillation, which is an abnormal heart rhythm in the upper chamber. He had very severe gout. And he was recommended for heart transplant because his heart was beating only at 11%. 50 to 55% is normal, so it's beating 1/5 of normal. And he was requiring hospitalization every 1 to 2 weeks prior to seeing us. In fact, he had just been discharged from the hospital prior to coming to our center when he arrived. So when he arrived, he was on 9 different medications, including insulin. And so these medications were contributing to some of his problems. The diuretics, although they had to be diuresed, but it was causing him to be dehydrated. And so the kidney function was suffering from that. Some of the medications were having to be processed through the liver, which was already weak. So he was in tough shape, needless to say. What was his baseline condition? He was fluid overload when he came to our center. He was short of breath, and he had pain throughout his body, his neck, his hands, joints were all severely arthritic and painful. We had to give him large doses of intravenous diuretics. We initially started him on a cold press and a smoothie detox. We took away all solid foods. We gave him large amounts of anti-inflammatory supplements, liposomal curcumin. That's a liquid form, a liposomal form of curcumin. It's an active ingredient of turmeric. We started on a high-dose ozone infusion in the form of EBU. EBU stands for extracorporeal blood oxygenation, ozonation. So to make a long story short, this patient, in the first few days of our treating him, he was coming to our center every day, staying at a hotel. He was getting daily treatment to sort of stabilize his condition. Now, before I get into that, we also began weaning his medications because that was important. And so we took away the insulin. We took away some of the arthritic medication because we were treating that with other medications as well. So this is something that we had to do right away. Anyway, so here is a picture of some of the joints. He had these nearly golf ball size arthritic joints there, and some of these start to go down. But this is the extreme gout, and these are called gouty tophi. Now, initial results, echocardiogram, we repeated, showed ejection fraction 10 to 15%. Stress, he only went 2.5 minutes. He had baseline atrial fibrillation, and labs showed signs of liver impairment and kidney impairment, as well as overall inflammation. And these are some of the labs that we ordered initially. NT-proBNP, this is a measure of heart failure. It needs to be less than 32, and you can see this in red. Lots of inflammation, that's what you see here. You see kidney function abnormal, liver enzymes elevated, and total bilirubin elevated, blood sugar elevated. This is a sign of abnormal blood flow, blood vessel disease, and that was elevated. So here we had a situation, this individual was very ill, and we started with this integrative approach with nutrition, supplements, and medication weaning right off the bat. Now, as I mentioned earlier, he was in a condition known as atrial fibrillation. And so we started him on a medication called amiodarone. It's a prescription drug. It's cleared through the liver, so it's wasn't an ideal medication for someone with liver failure. But the reason for this is I want to get them on something to help get them out of the atrial fibrillation, because I start them on what we call an amiodarone loading dose. And then we took him to the hospital, did a special type of echo. We call it a transesophageal echo, where we look to the back of his throat and make sure there are no blood clots, and we shocked him from atrial fibrillation to a normal rhythm. This is an important approach. Now, this is the crux of integrative medicine. Notice we start with nutrition, medication weaning, we call it optimization, and then we also start them on some special targeted nutraceuticals, anti-inflammatory agents, ozone infusion, but then we still had to use some allopathic medical treatment because this gentleman was in atrial fibrillation. I wanted to get him from atrial fibrillation to sinus rhythm. This was going to be better for his heart. So we were able to successfully convert him to sinus rhythm. And as a result of these therapeutics coming together, we got significant improvement in some of his numbers. His NT-proBNP number went down. That was a sign that his heart was getting better. Inflammation went down. Kidney function bounced around. It eventually got better over time. Initially it went up, but this came down and improved. And some of the other parameters bounced around a little bit, but we saw significant signs of overall improvement. Platelet count got better, etc. His ejection fraction went from 10 to 15% to 30 to 35%. His pressure on the right side, the right ventricular systolic pressure, went down. That's a good sign. That's the pressure inside the lungs. As I said, NT-proBNP got better, and the atrial fibrillation was converted to sinus rhythm. This is very important because this improved his circulation. He had less leaking in the mitral valve, and the leaking in the tricuspid valve was about the same, but it was probably less because the pressure on the right side was less. And so here's some of the numbers in graphic form just to give you an idea. Inflammation cut in half, ejection fraction nearly triple, pressure on the right side reduced by a third, NT-proBNP reduced. Here's an important factor here, reduction in medication. This is a key because, again, the trap is the chronic illness and the medical treatment interplaying with each other. So you got to back off, wean off the medical treatment, as well as wean off the poor diet, and start to let the body heal itself naturally. This is the integrative approach that's necessary not only to avoid the issue of extreme chronic illness, but also once you're in that extreme chronic illness trap, this is the approach that helps bring you out of it. And so this individual was able to walk, exercise much more. He was here for over a month. Other than us electively taking him to the hospital for that cardioversion, he did not require any hospitalization for shortness of breath, did not have any episodes of fluid overload. We reduced the amount of diuretics he needed, and his condition improved overall because of this integrative approach. So this concept of extreme chronic illness is one that is very serious, is one that you need to take seriously. So if you're in any one of those earlier stages of chronic illness, such as poor lifestyle, etc., you know that you can abort it there, start to change your lifestyle, start to exercise, start to eat a healthy, natural, clean, plant-based diet, and all of these things. So these are the most important aspects of extreme chronic illness. And this is something that I hope that you get a lot out of, and I hope that it's something that will help you or loved one. Like always, until next time, take care. And if you have any questions, please leave questions, comments in the comment box, and either myself or one of my teammates will try to address them as best as possible. Until next time, we will see you, and we hope you have a great Saturday.